Good afternoon, guys. Discussion A today deals with health health cost sharing. Okay, so we're going to get into that, see what that entails. So join me for A, please. Okay, here we go. The line points to health cost sharing. Ministries and similar unregulated arrangements that look like low cost health plans but aren't insurance. They attract people with cheaper monthly payments, then deny reimbursement after care, especially for pre-existing conditions or benefits that traditional insurance is required to cover. What these plans are: these are membership based programs, often faith affiliated, where people may pay into a pool that shares medical expenses. Because they're not certified as insurance, they aren't bound by the consumer protection and coverage mandates that state regulated plans must follow. Why people choose them: they're marketed with significantly lower monthly costs and than traditional insurance, appealing to people priced out of comprehensive coverage or facing higher deductibles and premiums. The low upfront price is the hook, but the real risk shows up when bills arrive. How denials happen: pre-existing conditions. These arrangements can exclude, or limit coverage for conditions that existed before joining a practice buried under ACA compliant plans. Benefit limits: they can cap or narrow benefits in ways regulated insurance cannot, leading to unexpected out-of-pocket costs after care. Administrative discretion: because they aren't insurance, they can apply internal rules and moral behavior criteria, delaying or denying payment even when care feels essential. This dynamic contributes to surprise medical bills and debt burdens when care is finally sought. Commonwealth Fund, hc4us.org. How they differ from real insurance. Regulations. States and federal insurance rules do not apply, meaning fewer consumer protections and appeals rights. Guaranteed coverage. No guarantee of payment exists. Members request sharing rather than exercise a legal insurance benefits. Pre-existing conditions protections. ACA rules forbid such exclusions. Don't blind these programs. Don't forbid. Don't blind these programs. The bigger picture. Americans already struggle with affordability and denials, even within regulated insurance due to high deductibles, co-pays, billing errors, and algorithmic or administrative denials. Unregulated plans magnify these risks because they remove the guardrails, likely when the bill comes due. What to watch for and safer options. Red flags. Not insurance language. If it says it's a ministry or sharing program, not insurance. Exclusions and caps. Look for pre-existing condition limits, lifeline incident gaps, and narrow benefit definitions. Appeals process. If appeals aren't governed by insurance law, payment is discretionary. Safer options. ACA marketplace plans with guaranteed essential benefits and pre-existing condition protections. Okay. Then we've got Medicaid and CHIP, eligible or subsidized exchanged coverage. To reduce premiums and out-of-pocket costs, Commonwealth Fund hc4us.org for communities already facing cost barriers and medical debt. These plans can look like relief, but often shift risks into patients at the worst moment after care, widening inequities rather than closing them. Okay, guys, that's your A for now. I will be back on in a few minutes with B. Give me a few minutes to put that together for you, and I will be back on with that for you. For now, Gator Wellness, take care, folks.